Well, hello, everyone, and welcome to another Friday with the family. This has been such a highlight for my week because we get to talk with some really awesome people from across all campuses of OSU. And today, our guest is Dr. Kelly Dunn. I'm going to look over here to make sure I get her title completely correct. She is the Assistant Clinical Professor of Psychiatry and Behavioral Sciences located with OSU CHS. So, Dr. Dunn, thank you so much for joining us today. We're really excited to have you.
Thank you for having me.
Well, so we'll start with kind of a broad scale of what OSU CHS is doing right now. And then I want to get more into your specific look of things and mental health part of this and how it's impacting everyone in ways we didn't even really expect, in addition to the virus. All right, we're back. I'm so sorry. I had one job, and that was to stay on here with you. I don't know what happened with my internet connection here, but we'll get right back into it. We're here with Dr. Kelly Dunn, and she is the OSU Assistant Clinical Professor of Psychiatry and Behavioral Sciences. And so we're going to talk a little bit. Let's see, do we still have Dr. Dunn? We may be having a few more technical difficulties. So we'll see what we can do to get those figured out here in just a second. We apologize for that. start clean like we haven't started at all? All right, we're back again. So we're just going to keep doing this until we get it right. Thank you, Dr. Dunn, for hanging out with us. We'll go ahead and get back into it. So we were talking about what CHS is doing as a whole. And I know that they've played a big role in helping Oklahoma battle this pandemic. I watch the governor's press conferences and always see President Casey Shrum up there. Can you touch a little bit on that leadership and how that's looked?
Yeah, it's a great time to be a part of OSU. I've been really proud to be a part of this family. Dr. Shrum is doing an amazing job, not only leading our campus, but the state as part of the governor's task force to address this COVID-19 pandemic. And we continue just to adapt quickly to the needs as a team.
Absolutely. Yeah, it's neat to see on her lab coat that OSU emblem, and just makes us even more proud, which we obviously already are. And then our guest next week is Dr. Kenneth Sewell, and he is the Vice President of Research for OSU. He works out of Stillwater. And so I actually visited the Diagnostic Lab on the clean side, following all safety precautions there last week. And he was talking big time about how this was possible because of a partnership. And have you seen any of that? I know you're not directly involved in that specific project, but in the Diagnostic Lab, the partnership between CHS and then the Stillwater campus.
Absolutely. It's fun. In our just little clinic, it takes a team, and then all our team members are then out kind of being mobilized across the state. So CHS working with our partners in Stillwater, and OSU also leading the COVID Echo, and you get to see the kind of partnerships across the state really coming together, and it's a really good time to be an Okie. I feel really proud of how everyone's working together to address this kind of unanticipated event.
Absolutely. So let's talk about your specialty here. The mental health aspect is something that's really important right now. And people that haven't dealt with mental health issues before may be in this unknown. What's some advice, and what has your job looked like during the changes?
Absolutely. I think this is challenging all of us and in a new way. And people are kind of realizing kind of how resilient they really are. But there are some things you can do during this time to kind of address this level of uncertainty that's going on, this complete change in our routine. But the first thing is just to acknowledge that I think it's okay to feel anxious right now. It's not something it's very normal for the circumstances that we're all a little anxious. We're all a little on edge. We kind of don't know what's next. There's financial stress. A lot of that is going on. But some things you can kind of do to help with that is creating a new routine, a new schedule, something you can rely on, scheduling bedtime, scheduling meals. That can be really helpful. Also kind of focusing on things you can control, right? There's a lot of uncertainty. There's a lot of things going on. The information's new every day. So focusing on the things in your world that you have some control over can be very helpful and empowering when things feel kind of chaotic. I also I think gratitude goes a long way. So gratitude practices. And I like to do an exercise called Hunt the Good Stuff, because I think sometimes when life gets really hard, sometimes it's hard to find the good stuff because the kind of negative things are in your face so much. So I kind of like that term, but just thinking about the things in the past 24 hours that have been good and kind of taking a minute to do that, that can be really, really good for your well-being. And then I was going to mention, they talk about the pandemic, but there's also an infodemic, if that term's kind of been thrown around, that there's so much information right now going out that the information is almost more anxiety provoking than the actual COVID-19, and that the threat that the information's causing people is having more of an impact than even the actual threat of the virus. And so really picking one or two sources that are reliable and going to those sources so you're still informed about what's going on, and then you kind of just turn the rest of it off. We know healthcare workers, this is when Ebola was starting to kind of spread. that they did a study in healthcare workers, and the healthcare workers who did this had, lower levels of anxiety, higher levels of well-being. So as much as kind of filtering the information you're getting is equally important right now for your well-being.
Right. And what would be your advice to some of those healthcare workers, people that are out there on the front lines, to keep themselves in the right mental state?
Absolutely. And that's a kind of a big part of my job right now is working on that. And there's a few things the community can do, a few things that I'm working on as well. Community-wide, I think just acknowledging the healthcare professionals in your life and saying thank you for the sacrifice. It's very anxiety provoking right now. It's scary for a lot of them. We're not sure if we're going to have enough supplies. So you can imagine, a firefighter potentially going into a burning building without appropriate gear, or a soldier going into battle without adequate ammo. Like this is the current question on a lot of healthcare providers' mind right now. And so just kind of acknowledging that you see them and that you see them and you value what they're doing, that can go a really long way. Also staying home right now. I don't like the term social distancing because I think we need to stay connected. So physical distancing, I think, is a more appropriate term. And so continue doing that. It is impacting Oklahoma right now in a good way, in a way that the healthcare system is going to be able to keep up if we follow the current projections. So we have to continue that. I know everyone's getting really antsy and wants to leave their home or wants to make that one trip. But if we can just continue staying home and doing that well, that's going to really help healthcare workers right now. And then I've started a support group for frontline healthcare professionals across the state. So, just a safe place to kind of talk through what you're going through, I think can be really helpful. Family members are always really supportive, but something special about the camaraderie you get when you're talking with people who are going through the same thing, that can be really helpful. So those are some of the things kind of we're offering for our healthcare professionals.
That's very cool. So if healthcare professionals are watching this, where can they find the information to become a part of your group?
Sure. They can email me directly, and we can send that or post that, but it's kelly.dunn@okstate.edu. And we'll get them to the mailing list. And right now it's Tuesdays at noon and Thursdays at 8:30 a.m. I'd be happy to have them join us. And then I always encourage healthcare workers, they're at higher risk. They tend to not seek help as early as like the general population. So if the stress of this is becoming excessive, seeking help, professional help is also really important, that they're getting that support if that's needed.
Awesome. So she shared her email. That's kelly.dunn@okstate.edu. And then if you have any questions right now, just a reminder that you can add those into our feed, and we will be monitoring those and getting as many of your questions answered as possible. So we spoke on healthcare workers. What about people in other professions that have to work right now? Grocery store workers and people that are kind of on the front lines in their own way, making sure that they're getting us necessities. What would your advice be to people like that are still working?
Yeah, my advice would be to continue to advocate for yourself, for the protective means you need to do your job. Just like healthcare professionals, they need the masks and the face shields. What you need to do your job well, to speak up. I know that's hard sometimes when your well-being and your paycheck relies on it, but looking at the things that you need to do your job well, recommendations like keeping your hands clean, keeping distance when you need to, wearing masks, and also just monitoring yourself. Take a minute to check in, like, how are you doing? A lot of people seem to be doing actually quite well, and that work's kind of protective. It's keeping their mind off a lot of things. But if you find yourself, seeing symptoms that this is really affecting you, and those symptoms would look like maybe you're having trouble sleeping, you're more irritable than normal, you're on edge, you just feel kind of on edge, it's impacting your relationships, then I would encourage them to seek help and find some support. And the earlier, the better. So don't wait till it's really really bad, and come get help. We're here. Healthcare professional, the mental health field has adapted quickly to be able to continue providing services. So come see us. We'd be more than happy to help.
And then social distancing, you mentioned already that you don't like that term.
Mm-hmm.
What can people do to stay social while distancing, to stay informed and be around people via technology?
Yeah, it's fun to see how innovative people have been to stay connected. I really encourage video platforms like FaceTime. Body language is so important with communication, so it goes much further than texting or just a telephone call. So anytime someone can do FaceTime and really see the other person and interact in that way is important. I've seen family members of nursing home residents, talking through the windows, or that kind of thing, and the Facebook challenges, the safe ones, not the unsafe ones, but just people kind of coming together using a sense of humor. Those kinds of things can make us feel connected during this time.
You got push-up challenges, dance challenges. I've seen them all lately. There's all sorts of stuff floating around out there. And social media, though, can be both. It can be a huge help, but it can also be something that triggers some people. So how do you find that moderation?
I think just being very aware of how you're reacting in the moment. You're right. 1 minute our neighborhood put rainbows in the window so the kids could take walks and find all the rainbows, which was really sweet. So 1 minute you're looking at that, and the next minute you're reading a post on, how the world's ending. So it's hard to really filter that. And I think you just kind of have to be very aware of how you're responding. And if you need to take a break or step away or even schedule time to be on your phone so you're not on it all the time, then I would recommend that. And just being aware how you're coping. Our coping styles can be very helpful, but sometimes they can become negative. An example of this would be, you put on Netflix to kind of just take your mind off things. But then you stay up late watching Netflix, and then you don't sleep well. And so then the next day you're tired, which makes you more anxious and on edge, right? So you can see how a coping skill can kind of become a negative thing. So just being aware of how your coping is affecting you can also go a long way.
How important is having a schedule for people if you're working from home?
I think most people thrive really well on schedules. It just creates structure. There's so much uncertainty right now, and kind of having a schedule, something you can rely on and predict, can be really comforting. Our bodies are naturally on a 24-hour rhythm, right? So kind of feeding into that can be really so helpful. Going to bed at the same time, waking up at the same time, no matter what your days has planned. Kids particularly do really well on schedules too. And so not to be too rigid with that, but setting a schedule for your children can help them thrive during this time as well.
What are some things that you've seen during this time specifically that are maybe some triggers for people that they should avoid?
Yeah. We mentioned the kind of all the information out there. I think it's fun to see all the posts of how people are kind of getting to know their family members or their spouses in a new way. So having kind of grace for just being around each other so much. It's the unpredictability of what's going on. The lack of freedom to just go out and do something. I think that's really triggered a lot of people. I think the screens have been good to connect, but too much screen time can kind of make you feel tired. So that can also trigger others. And I think all our personalities are a little different. So we all are coping a little bit differently and handling quarantine a little differently. So I've seen people get really irritated that some people are staying home and then they see other people outside congregating in the driveway. And so taking a step back and again, just reminding yourself what you do have control of and contributing in that way can be helpful when you're starting to feel that way.
Absolutely. And then something else that I know you focus a lot on is addiction medicine. And
Yes.
How is the COVID-19 crisis affecting the patients you serve? I mean, I would assume it being home and not having other things to focus on may make things harder.
Yeah, addiction's kind of a disease of isolation to begin with. And so we're kind of in a situation where people are isolated in a sense more than ever. The peer recovery groups like AA, they're not meeting together right now. And the residential treatment facilities have kind of had to take a step back and close their doors for a minute to figure out how to handle this. So the resources have kind of stepped back, and that's put this population at risk. We have the COVID-19 pandemic, but the opioid epidemic has been killing Oklahomans at a high rate for a while now. And so it's kind of anxiety provoking for my patients, but there's some good news coming out from all this. Our clinic's adapting. We're at virtual visits now, which has really actually been really enjoyable. The treatment facilities are stepping up and figuring out how they can continue seeing patients and still keep people at low risk for spreading this virus. We've actually had better engagement from our patients because they're seeing me from their home, so the transportation issues aren't there, and that's kind of been really encouraging. The NA groups, the AA groups, the Celebrate Recovery groups, they're starting online support groups. So we're seeing a response, but there was a delay there of kind of trying to figure out how do we still meet this population's needs, and we're getting there, but it's been slow. So if you know somebody who struggles, like reach out to them, help them connect to resources. Our clinic is seeing patients. We're seeing new patients. Come see us at OSU in Tulsa. But so yeah, it's kind of mixed. It's interesting. It's very interesting.
Yeah, everybody's having to figure out new ways to do their work, and on your level, it's even harder because it is so important to take care of those patients and to do that in an effective way. So we do have a few questions coming in. I'll get those while we're in the middle of our own questions. But one that came from an audience member was, what can we do for the elderly that are currently isolated?
Yeah, absolutely. I'm hearing feedback that a lot of that population is actually doing pretty well with technology. So I wouldn't count them out for them unable to use that. A lot of them kind of have smartphones, so if they have access to that, like figure out how you can FaceTime them would be good. Like I mentioned in the nursing homes where visitors are very much restricted because that's an extremely high risk population. I've seen them kind of peek in the window just so they can see a face. Even if picking up the phone and the phone is the only option, call them. Check on them. Do they need groceries? Can you run to the store and get them groceries so they don't have to enter that environment? That can be very helpful for them. I've seen pharmacies are starting to, where they didn't normally, are delivering meds or figuring out ways to get medication to this population so they don't have to, again, be exposed. So mitigating their risk is really important, and meeting their needs practically, but also just connecting with what you can. Maybe it is just a phone call. Maybe they do figure out FaceTime, but we're all kind of struggling in that. But we're all doing the best we can.
Make sure they have some sort of connection.
Yes.
And that's great. Well, in addition to setting a schedule, do you have any other tips for families with kids at home and helping them adjust to this new normal?
Absolutely. Yeah, absolutely. I unfortunately, because I love my kids, but I'm right there in the boat with you, families at home with children. So a few things that I think are really important is that as adults, as parents, you have to care for yourself first before you can care for children. So that's always my number one recommendation is, are you checking in with yourself? How are you doing? Are you doing the things you need to take care of yourself? Because if you're not, then you're not going to be able to deliver the care you want to your kids. So take a minute, and what do you need? Don't feel bad about taking care of yourself. You'll be a better parent for it. Same with healthcare workers, anybody who's caring for others. Like you have to put the oxygen mask on yourself before you can put it on somebody else. We mentioned kind of routine and schedule. Again, that brings a lot of security to children. Play is very protective for children. So I know there's a lot of distance learning. There's lessons planned. Parents are doing their best to become full-time teachers on top of everything else. But don't negate the play aspect. That's very protective in times like this. So, if that means they don't finish their lesson completely, and that's okay. So having grace for that. And also having developmentally appropriate conversations. Children are pretty smart, and they know things are different, and so talking about it's really important on their level. I have a 5-year-old. She knows she's not in school right now. She misses her friends, so we talk about that. We also bring up we're staying home to protect other people right now, and so we bring meaning and purpose into the sacrifices we're making together as a family. And so children can have those conversations. You don't need to kind of avoid talking about the virus. Bring it up, talk about it, make sure they feel like they know they can talk about it if they have questions. That's really helpful as well.
Absolutely. Yeah, I think you're right. We forget that they understand everything. They may not comprehend why it's happening, but they know it's weird. So I think that's great to have those conversations along the way. How important is it to get outside during this time period? Because I know we're supposed to stay home as much as possible, but they have said it's okay to take walks, and as long as you're following social distancing rules.
Absolutely. I mean, in pandemic or no pandemic, outside is also protective. Getting sunlight is really good for our mood, moving our bodies. Not only does that help our bodies stay, fit so we can fight off infection, but it really has a huge impact on our brain health. So moving our bodies, getting out, getting fresh air, getting sunshine, all these things are just basic needs to do well. So if you're not doing that, it's hard to add all these other things. But luckily, hopefully, we'll continue having some better weather, and so people can go out and enjoy that.
Yeah. Some days it takes till the end of the day for me to realize what the temperature is outside because I haven't, opened my door yet. But on the days that I am able to get out, it does. It changes your mood for sure. Well, thank you so much for joining us. Before we close off here, do you have anything else that you want to add? Anything that our OSU family needs to hear right now?
Yeah. Let's see. I wanted to mention 211. It's a good resource for anyone in the state who wants to be connected to resources. It's a pretty comprehensive list. You can Google it or call it. So if you're needing more resources, check out 211. You can also go to the Oklahoma Department of Mental Health and Substance Abuse website. That's ok.gov/ODMHSAS. So they have up-to-date information. They have support lines. OSU has advanced their virtual medicine at an incredible rate in the last couple of weeks. So virtual medicine is up and going for OSU medicine. So if you need kind of that support, you don't have to wait. You don't have to avoid a hospital. You can get that appointment now. So look into those things. If you need the help, reach out.
Absolutely. Yeah. All amazing resources. Thank you for adding that as well. Okay. Well, I do have a few announcements before I let everyone go today. We do want everyone to know that the OSU Foundation has set up Philanthropete. And you know what? Let's see. There it is. I'm looking at a Google Doc and it disappears. So there must have been some change in that as I was going. But they have set up the Philanthropete Project to accept donations toward critical medical gear for our employees at OSU Medicine. And that will be up on the Cowboy family website soon. The OSU Alumni Association also has a wealth of other resources available for how you can help during the coronavirus outbreak. Visit Cowboy Family for all. And he will be speaking in detail about that diagnostic lab we mentioned, and again on that partnership with OSU CHS and then OSU in Stillwater as well. He's the Vice President of Research at OSU. Now you'll find a link to register for that now on the cowboy.family website. So lots of resources for you there, lots of resources that Dr. Dunn mentioned as well. Thank you so much for joining us. It's really important right now to get all that information out there. We appreciate all the work that you're doing.
Thank you so much for having me.
All right, guys. Well, I'm Julia Bimbrook. Thank you for listening. Stay safe, stay healthy, and as always, go Pokes.